last week we started a very important conversation on the condition that occur in men, erectile dysfunction. Erectile dysfunction, as you may be aware, can have both physical and psychological effects on men that experience it, causing stress, relationship strain, and low self-confidence. But what do you want to know, and what must you know? What are some of the signs you need to look out for? Now, in the studio this afternoon, of course, is Dr. Josephine Awortwe, Head of Clinical Services at the Spin Test Medical Center. Doctor, you're welcome.
Thank you.
And last week, maybe we can start by refreshing our memory on what really erectile dysfunction is about and the possible causes.
Okay, so last week we spoke about what it is, and we said that it is the recurrent inability to attain and or maintain a good erection, penile erection for satisfactory sexual intercourse. Okay, so some of them will not be able to attain erection at all. Some would probably attain it but not sustain it over a good or satisfactory period to engage in proper intercourse. So if you have something like that, then we say you have an erectile dysfunction.
That's in relationship with impotency.
It is also known as impotence.
Okay.
I mean, the other name for erectile dysfunction is impotence.
Wow.
And last week we spoke about the difference between impotence and infertility.
Perhaps you can refresh our memory on that as well.
Yes, so the impotence is erectile dysfunction, as we've already spoken about. The infertility, you can, be able to engage in the act, but not fertile enough, not have good enough sperms in order to, impregnate someone. Okay, so that means you are infertile. You are potent, but you are not fertile.
But is there a correlation between the two?
Not necessarily, because you see the sperms, being infertile has to do with your sperms. Okay, so how producing the right amount of sperm, the semen, how good they are and all that, the quality and everything associated with it. But when it comes to the impotence, it's about you being able to have an erection, engage in the act. Okay. Mainly.
All right. So, and what are some of the causes of this? Last week you told us about age being a factor.
Yes.
And what age should one be worried, or should one be concerned about her, erectile status?
We spoke about the fact that by the age of 40, after the age of 40, that's when we realize that most people start having this issue of erectile dysfunction. The main reason is, underlying erectile dysfunction is a lot of health conditions.
Right.
So most of the time, we can categorize this into two main categories. We have the psychogenic causes and organic causes. So the psychogenic is more about your psyche. When we say the psyche, it's more psychological. Okay, so some people may not be able to engage in it because of performance anxiety.
Thinking that he may not be able to perform.
Maybe they had one episode that didn't go well, and it always has this, and maybe it wouldn't happen again. Like maybe it would happen again, will not be able to perform again. So that anxiety would actually cause you not to perform well. Some of them have this widowhood effect. Maybe somebody engaged, maybe was married or was in a very good relationship and then lost the partner. And
it's affected the person.
It has affected the person. So maybe when they engage, they meet somebody else, they can't engage in it. Sometimes it's stress, sometimes it's anxiety, sometimes depression. So all these psychological issues can also affect it. Sometimes there are some men that they can attest to the fact that when they are very stressed at work, they can't really perform because it really affects your psyche. So those are the psychological causes of it. So especially the younger men, usually when they have erectile dysfunction, it's more psychological than organic, although people have both of them occurring at the same time. But there are lots of medical condition that makes people get erectile dysfunction. Okay. So my main concern is the fact that although you may have an erectile dysfunction, it may be due to some medical condition you have.
And not because of stress or the other matters.
Yes, not because of that. Maybe because you have an underlying condition.
Like what?
Hypertension.
Okay.
Diabetes. Okay, so the thing about erectile dysfunction is, it starts from your brain, then it comes down to your vessels on your nerves. So anything that affects your blood vessels can cause erectile dysfunction. Anything that can affect your nerves can cause it. Your brain can cause it. So if you have stroke, it can make you get it. If you have any surgery going on around your pelvic region, it can cause erectile dysfunction.
Meaning what? The blood is not flowing well?
So you see, for you to have an adequate erection, you need blood flow into your penis. So it's a whole anatomy that maybe we can talk about at another time. Sure. So any condition that affects your blood vessels, so anything that can cause stroke, that can cause heart attack, can cause erectile dysfunction. Because whatever changes that is occurring in your heart or in your brain can occur down there. So most of the time, it can even be a risk factor. The fact that you're having these conditions, it can even be that if you don't treat it, you can have worse condition later. So diabetes is a culprit, hypertension, obesity, tobacco use, alcohol. Abusing alcohol can cause that. Tobacco can cause it. Cholesterol issues, dyslipidemia, it can all cause erectile dysfunction. Okay, medications, all of these things can cause erectile.
So for alcohol, for example, is it your suggestion that perhaps for men who are listening, they should quit it completely?
So usually when it comes to alcohol, it's about consuming at the right quantities. There are certain let's say quantities based on what you are drinking, whether it is spirits or it is beer. You shouldn't go beyond a certain limit in a day or in a week. So when you abuse it, that is where all these conditions happen. When you abuse alcohol, aside erectile dysfunction, you can have liver conditions,
right,
all other conditions, and they can also cause erectile.
But then how then do you advise? How then do you talk to men that resort to the taking of alcohol to enable them perform well?
Asking somebody to quit completely is also a big challenge. Okay, so it's about drinking sparingly and wisely.
Some men feel that it helps them, it helps put them in the mood, it helps them perform well, and you say that they may be, the side effect may rather be the opposite of what you are intending it to do for you.
You don't need to abuse alcohol to perform well. Sometimes puts you in the mood, makes you feel elated, but you don't need the abusive quantity, a large quantity of alcohol. You don't have to binge in order to get yourself there. Okay, something very, maybe one shot, I don't know much about these things, just to put you in the mood is okay. And it shouldn't be a habitual thing you are doing all the time, because we should know that aside the erectile dysfunction, abusing alcohol has its own,
of course,
yes, effect.
So for our fathers that we grew up watching them take a beer every day, one bottle of beer, and then some of them had multiple wives. They were still giving birth at age 50 and 60 and the likes. And I come back to my question about whether, as a man, you should consider cutting alcohol out of your life completely, or moderation should be the word.
Like I was saying, not completely, but in moderation. You were saying one bottle of beer, that is acceptable. But you see, there are lots of people who drink a lot. At a goal, you see a lot of bottles, and then some people taking a lot of shots of spirits and things like that. So when you add the units of alcohol,
some have actually died in the process of the alcohol helping them to perform. Somebody's asking about energy drinks.
So it depends on what is in that energy drink. Okay, because we know that, you see, taking tobacco and all that, smoking, is all related to erectile dysfunction. So it depends on what is in it, and you're not abusing it. So the catchword is doing things within an acceptable, range or rate.
Okay.
It's not abusing things. Yes.
So, when we started and we spoke about age, you took us to age 40 and above, and you said that you should, when you get to that age, those things are opportunistic things that obviously will happen to your body. Now, we know that because of the awareness on cardiovascular disease, we understand that young people are getting stroke here and there, sometimes even in their 20s, in their 30s. And so for such people in that category, knowing very well that stroke or having high blood pressure could be a factor, is it safe to say that perhaps we should look at people from that category as well, so be mindful of the effect of such on their overall development?
Like I was saying, most of the time, people with erectile dysfunction have an underlying disease. Okay, so my take is, when you have an issue like that, instead of assuming that it is because you are aging and because it happens to men, so you're just going to buy medication and do it, I think you should go and see your doctor. And then let them find out if you have someone, because it could be a sign that maybe you are developing hypertension.
Right. Then
later on, you realize that you get a stroke. Maybe this was the sign that could have helped you diagnose your hypertension and treat it. So the point, you should go and see, although it's difficult to talk about it, so that they can investigate thoroughly, so that if you have any underlying condition, it can be managed. For somebody with diabetes, for instance, although diabetes is a bad culprit,
right,
when you are able to control your sugar level, have a good glycemic control, you won't suffer these consequences. Meanwhile, you wouldn't know you have diabetes, or probably you have diabetes, but you don't know that that is what is causing it. If you go to the hospital and then you manage your diabetes, then you would be able to, solve your issue with erectile dysfunction instead of just going to buy medication. Because a lot of people are just going to buy medication to help them perform better, ignoring the fact that it could be that there is something happening, and then later, years down the line, they'll get a stroke, they'll get a heart attack, and they'll get other conditions.
And the unfortunate thing is that a lot of people are walking around not knowing the state of their health.
Exactly.
Whether they have high BP and then something happens and then, oh, it was just fine, then this just happened.
And they just go buy medications over the counter to help them perform better because they have this issue.
Can erectile dysfunction be reversed?
Yes, it depends on the underlying cause, like I was saying. So sometimes lifestyle modification, let's say you start taking your, medication, controlling your sugar, you start losing weight because you are too obese, which can also cause erectile dysfunction, maybe cut down on smoking. If you're able to handle those issues, then you can start reversing some of the processes that happen. Sometimes medications, some antihypertensives, some medications for prostate, medication for depression, and all these things can cause erectile dysfunction.
Yeah, because the claim is that even some of the medication that is prescribed for people with BP,
yes,
the side effect is that it affects their erection.
Exactly, and people with prostate issues,
people who are on such medication.
Yes.
Is there any remedy for them?
Yeah, because we have different categories of antihypertensives. That is why it is good to engage your doctor. Get a good doctor that you can really talk to. Because you see, they are different. You might react to it. Somebody else might not react to it. Now, a doctor has put you on this antihypertensive. We want you to achieve your get a good control of your blood pressure, but we don't want to put you at risk of other things as well. So when you come and tell your doctor that, doc, since I started this medication, this is what I've noticed. The doctor will change the medication. Okay. Because we have other categories of medication that will not cause that side effect, so they will switch for you. So you just have to go back to your doctor and tell your doctor about what you experience, and your medications can be switched.
Is it possible for a man, the Bible prescribes that should be 70, and above 70, that one is the grace of God. But is it possible for a man throughout his lifetime to maintain his erection throughout? Is it possible? Is it scientifically possible?
It is. We have old men who are performing very well. Old men who are impregnating young women, and so yes, we have people doing that. And you see, when we talk about remedies for erectile dysfunction, we realize that we have so many ways of getting people to have an erection and engage in their sexual activities. So because of that, we have people who are really interested in engaging in sex. We know old men who have died in the act of sex.
Of course.
All that. Yes, so it happens.
And then few issues before we wrap up. So there are also men who are also resorting to herbal medicine. They heard it on radio, or somebody spoke to them about it, and then they are using it without subjecting it to any scientific proof. And then there are also over-the-counter medication that people use to help them stay fit and then to go about that. What would be your advice to such individuals? Okay,
so we actually have medications that we use, to treat such conditions. I know that most of the over-the-counter drugs have components of these medications. And then some of these herbal preparations actually have components of these, Viagra and things.
Right.
Some of them actually put it in the herbal preparation in order to help people. So you realize that most of these over-the-counter drugs have some of these medication. But you see, it is very dangerous because some people, there's a lot of imitation on the market, and some have additives. Some of these same herbal medication. I don't like talking about herbal things a lot because since I don't know the components in the medication, I rather want to stay away from it. So maybe they have put a medication that works, but then there are other components of the herbs that you are also not aware. And maybe you have a kidney condition, maybe you have a liver condition, you don't know. And then whilst something is working somewhere, something may be getting ruined somewhere. So it is best to know what you are taking. That is why you should see your doctor and get a prescription, know exactly what your issue is, and deal with it accordingly.
So 2 quick issues: the lifestyle change that one must adopt, exercise, and maybe the kind of food to eat. Is there any advice around that area too?
So usually when it comes to the lifestyle, what we want to attain is good sugar control, so that we don't have high blood sugar, because diabetes...
Meaning you should stop taking in sugar?
Not necessarily. If you are diabetic, you should see a dietitian and eat such that you achieve good glycemic control. Hypertension. So it's about carbs, cutting down your carbs, because your cholesterol level plays a very significant role. Your arteries, because of the blood flow that is required for your erection, anything that destroys the lining or blocks it can cause erectile dysfunction. So the high cholesterol level in your blood and all that really causes erectile dysfunction. So you cut down on carbs, you cut down on junk, high cholesterol, laden food and all that. You have to exercise because obesity too is a culprit. So you have to get the right, body weight and all that. So when it comes to lifestyle, cutting down alcohol, stopping smoking, losing weight, exercising, making sure your blood pressures are controlled, your sugar levels are controlled. Very important for erectile dysfunction.
And then how do you also deal with the psychological, effects of this subject?
The psychological effects, it's best your partner is involved, okay? And usually you see your psychologists, or psychiatrists so that you can go through therapy. Sometimes you may need medication, sometimes you can go to therapy. Some will require stress management, some will require medications for depression, some will require just counseling. So you have to see a doctor, and then later the doctor will let you see a psychologist, a psychiatrist, and that aspect can be handled as well. It is very important that when you're handling this issue, especially for them, engage your partner, because when your partner understands the situation, it's best for the both of you.
Just in your final words as we take leave of us.
Okay, so I would like to say that erectile dysfunction is very common. Lots of men are suffering from it. And there are lots of conditions that can cause it. Just don't rush to the pharmacy to get a pill or some herbal concoction in order to make you perform better. Go see your doctor. Find out if there is something that is causing it so that you can be managed for it. If not, in future, that same thing will cause complications somewhere, either in your heart or in your brain or something else. That wouldn't be good. Please take care of yourself and stay healthy.
All right, Dr. Josephine Awortwe is our in-house doctor, if you like. So she's on the show every Friday at 4:15 on our Health Beat.